Hi, my name is Efren Colasso. I'm a doctor of athletic training student at Moravian University, and this time I will be presenting a video of rehabilitation exercises for patients with chronic pain in the cervical spine. And why do I want to present this video to you? Well, as we athletic trainers know, it is true that highest incidence of cervical injuries in sports are those associated with trauma, and on very few occasions we work with athletes or patients who present conditions associated with chronic cervical pain. However, athletes are not exempt from suffering cervical injuries that can progress to a chronic condition, since they are constantly exposed to loads in this anatomical region as part of their sports activities. For this reason, I want to present to you a rehabilitation program of cervical exercises utilizing a series of specialized equipment for rehabilitation of cervical injuries. According to Nusser et al. 2021, the most effective way to manage chronic neck pain is by doing therapeutic exercises. Although there are several therapeutic modalities to manage chronic cervical pain, it is highly recommended to use it in conjunction with therapeutic exercises. In this video, I will show you a cervical exercise routine where I will be applying loads using 3 different tools. Do you want to know what they are? Let's go. The first modality that I want to present to you is the hands. Yes, your hands. Research has reported that manual resistance is effective in managing chronic cervical pain. As reported by Mato Mala in a research conducted in 2019, participants diagnosed with chronic cervical pain presented significant results in pain reduction measured with the visual analog scale, presented better cervical reposition sense, and better joint positioning error after undergoing a therapeutic exercise program focused on PNF patterns under manual resistance. This is a great alternative because of how easy it is to perform and its cost effectiveness. So it's time to do some cervical rehabilitation exercises. Let's begin. First, we're gonna start with the isometric contraction exercises. Hold the patient contraction for about 5 seconds and do all these exercises in all motions of the cervical spine. Do it in flexion, extension, lateral flexion, and rotations. You can do 2 to 3 sets, 10 to 15 repetitions, depending on the intensity you want to add to the exercise. Remember, you can do this also with concentric or eccentric contractions. A very important aspect of this program is the PNF pattern exercises. By the patient doing flexion, lateral flexion, and rotation. Complete 2 to 3 sets of 10 to 15 repetitions. The second modality is known as the motion guidance. Motion guidance is a visual feedback system that uses a laser device to direct the patient movements as they perform rehabilitation exercises, guiding them to focus most on the motions that will provide the most benefit and helping cue them to build good habits. The device is attached to the patient's body, in this case to the head via strap, and the laser is trained to targets or series of targets on the wall. The patient is then directed to move in such a way to make the laser trace a pattern of 8 targets in sequence. This type of training is classified as a cervical kinematic training, which enhances cervical kinematics functions. In a study conducted by Bahat et al. In 2017, laser rehabilitation demonstrated significant results of neck disability index, global perceived effect, cervical motion velocity, and other outcomes measurements of cervical spine function. As you can see, the patient have the laser at their head, attached with the strap. That laser is pointing
to the wall. Instruct the patient to move the laser in different patterns. It could be from up to down, or side to side, or just go across all the lines in different patterns. In this video, you can see that I instructed the patient to do circular motions. Go from little circles and open wide to do more bigger circles. Don't get shy to select a pattern. Be creative and have fun with the patient. Try to select some patterns that you know the patient have some difficulties. In that way, you're gonna do something to help the patient get stronger on that direction or on those motions that the patient is presenting some difficulties.
And last but not least, I will present an exercise program using the iron neck. The iron neck is a device that can apply linear resistance or isometric training, but have a unique characteristics due to its ability to bring resistance with the rotational motions of the neck. The resistance is provided by a resistance band that is attached to the device positioned at the patient's head. Then, the patient moves the head through the desired range of motion against the resistance of the band.
This is the iron neck. As you can see, the patient have a special brace on the head. Attached to the brace is the resistance band. As clinician, hold the band at the opposite side. A unique characteristic of the iron neck is that you can do some exercises related to retraction and protraction of the cervical spine, as different as doing with the hands. This device is better and more comfortable for you as a clinician to make some restrictions. Then you can do some concentric exercises and finishing with the rotation exercises. As you can see, the iron neck have a device that you can adjust the amount of friction. If you put a lot of friction, then you are working more with that isometric contraction. If you lose that friction, then you're gonna let the patient do the rotations. And then as your clinician, you can pull towards the opposite side of the rotation to put some stress and strengthening that area. And this is the end. Thanks for watching.